Hi, I'm Stephanie with the Note Ninjas, and together with Nicole, the OT, we help therapists with treatment ideas and documentation. So today, I want to talk about transfers, specifically walking to a chair, turning, and sitting. This is a very functional activity that we should be working on a lot with our older adult population. So, first of all, a lot of times when we're working on transfers, we are just working on sitting up and standing down. But I mean, that is so structured and so just plain black and white. How do they get to that chair? What do they have to do after? We need to be sure we are working that in therapy because that's skilled and it's getting the patient back to what they really want to be doing. So we should be practicing sit to stand and walk a certain distance, or walk a certain distance, turn to be able to sit in the chair. This is a great progression from regular sit to stands, which also shows your skill, but it's also so functional and something we really have to be working on. But how about that patient where they're walking, they're going to sit in the chair, and they're just like plopping there and jumping into the seat? I mean, I know this happens to all of us. They're like jumping in, they're in a rush, maybe they're scared of falling, they just want to sit down. And we're saying, slow down, wait till your feet are touching the back of the chair, all of these things, and they're just not getting it. Something else that we can do or use visual cues. So we can have maybe colored dots on the floor where the patient has to step onto, get to that spot, two dots, and turn on the two dots to sit down. We have a short video of it, but let me just tell you, we did use plates for this, and we don't suggest using plates. Make sure they're sturdy because these are kind of wobbly, but it gives you an idea of how you should do the exercise. So check it out. Okay, so this is a great visual cue. Sometimes the more verbal cues we get, saying the same thing over and over, maybe it just doesn't click in the patient's brain. But seeing exactly where their feet are supposed to go and do can really help. So try using this on the floor. And like what I said, don't use plates. You can use colored tape. That would probably be the best option. And then make sure to document this. Patient progressed from sit to stands to walking 10 feet, pivoting and sitting. Patient required what kind of cue, guidance, assist from you to be able to do that. Patient required visual cues on the floor for proper lower extremity placement. Or maybe patient required that plus a tactile cue on the back of their legs in order to make sure they're close enough to the chair. Or maybe they required physical assist because of their legs not being coordinated and crossing over each other. Whatever it is, make sure you document it because that's all skilled. Just working on the same treatment every single time, giving the same cues, is not going to do it. It's not going to show your skill in your notes. Plus, if you have gone multiple treatments, it's obviously not clicking for the patient and they might require something else. So just remember, what did you work on? What functional goals it related to? And what cues, guidance, assist did you provide the reason they came to therapy and couldn't do it somewhere else? We hope this helped. And for more treatment ideas and documentation tips, make sure to follow the Note Ninjas.